If there's one thing I've learned in my practice over the last decade, it's that there is a lot of misinformation out there when it comes to starting a family. So how do you determine a baby's sex? Before we dive in, it's important to note that gender is a personal identity that exists on a spectrum, and it can change over the course of a person's lifetime. And most importantly, it's something that a person defines for themselves. Sex, on the other hand, is assigned at birth based on the appearance of a baby's genitalia. Gender is assigned based on sex, but it's subject to change depending on the person or child's gender identity. While sex assigned at birth often matches a person's gender, this is called cisgender, sometimes for transgender, intersex, and gender non-binary people, it does not. Sex selection is only possible via IVF with testing of the embryos via PGT, preimplantation genetic testing. There is no such thing as spinning the sperm for a specific sex or any of the other old wives' tales out there. PGT is the only way. PGT checks the chromosomes of any given embryo. A normal makeup is 46XX, which is female, or 46XY, which is male. PGT is about 98% accurate when it comes to testing the chromosomes, so there's always room for error. Although risks are rare, they are always possible with IVF as it is a medical process and a surgical procedure. While there is a general price range for this, it's always best to check with your insurance carrier and fertility clinic for costs specific to you and your treatment plan.